Society normally has, I know here in Sweden, they say roughly about maybe 200 people in ICU. That's extreme cases.
Yeah.
But generally it can be down to 80. In the UK, it must be a bit more higher than that, I would assume. So now you're having a virus where you need thousands of people to be on the ventilators. I was listening to the New York mayor speaking about they literally scouring the earth looking to purchase ventilators, the migration. And this I personally experienced when I was in Italy, when we were leaving Italy, the fear of coming into contact with somebody at the airport. Just the thoughts, the taxi drive, the bus driver that was driving us to the airport, the stress around that, him telling us, you guys need to get out of here just before they lock down streets.
Jeez.
It took us, I remember the trip, it took us 3 hours to get to, when we left Milan, to get to Bormio. On our way back, it took us 2 hours. So this guy was really traveling really far. And the fact that he was stressed also made us more stressed. Does he know more that we don't know?
Hey, yo! It's the LifeShot podcast. Change your world and change the world.
Wayne, how are you doing today?
I'm good, thanks. Clint, and you?
I'm very good. And for the listeners, I'm speaking to Wayne Dilles. He's a scholar in political science and economics, lives in Sweden. Originally, me and Wayne know each other from Durban, South Africa, and I think it's been 15 or more years that we've known each other, Wayne.
Yeah, I think so. Yeah, definitely. I think even more than 20.
I think, well, I was just thinking about it today. I've definitely known Carvin H, who was going to be on the call today for 20 years. And I'm not sure how soon it was after that I met you, after meeting Gregory and Carvin.
In fact, when Brenton introduced you to Jizzo and Vino in Manridge, I was there with Brenton that day.
Ah.
I don't know if you recall. So yeah, that's when we went to find those guys.
My memory is not the best, so I don't remember that day. But yeah, we've had some very good times in Durban, and unfortunately, as the world goes, a lot of us have dispersed all around the world. I live in the UK, in case some listeners don't know, and Wayne is in Sweden. And we were going to talk to Carvin and Gregory in Durban, South Africa today. Carvin, who's also been quite vocal in his articles on Facebook and getting a lot of attention. And so what we do, we've got a little group chat going between us guys, and these Wayne and Carvin and Greg sometimes leave me speechless because they're great thinkers and have great insights. And I just thought it would be good to talk about the burning topic today, these days, which is COVID-19. And how it's affecting all of us. And I think Wayne being in Sweden and me being in the UK, it's quite, it was the epicenter. I think the USA now might have taken over. Is that right?
Yes, it has. Yes, it has, indeed.
But the death rate is quite low there. It's probably because the active cases, maybe they're still in the early stages. What do you think it is?
We're in the US?
Yeah.
I think the US is not really in the early stages. I think it's quite interesting, this virus. It impacts different countries and different cultural societies, groups in various different ways.
Yeah.
For example, if you go back in time from the very beginning in China, the first case or the first person to come into the hospital was on the 10th of December.
That's quite a while ago.
Yeah, that was a while ago. And then if you take the timeline, the first person died in China was, I think, the 7th or the 9th of January.
It's a month.
That's a month, roughly a month. And then they locked down Wuhan, which was the epicenter in China. And that was like the 23rd, just before New Year's. And if you look at the virus on the whole, they didn't think it would spread as fast until Japan, Thailand, and I think it was South Korea that first mentioned cases, that they have had cases. And I think the Chinese realized that this is spreading. And the thing with this virus is that it spreads fast. And I think that's what's taking place in the US at the moment. So I think from the death rate point of view, what most countries are looking at is the capacity that the hospitals can handle the intake of patients.
Yeah.
And at the moment, I think New York is facing a very challenging and difficult time, like you guys in London,
Mm-hmm.
the UK. At the moment, the hospital capacity is really being tested
Yeah.
to the max. And Italy experienced this, I'd say, 3-4 weeks ago. And it's been non-stop since then.
It just feels like it's been a whole lot longer. You know, if you think about the Italy thing, it just feels like this has been almost a lifetime in a way, just to me. I mean, people have different experiences about it. It just feels like this has been such a long thing, probably because of the drama of the situation. It just feels like it's been a lot longer. Like we've only been in lockdown for a week, and it just feels like it's been more than a few weeks.
Exactly. In fact, I was in Italy on the 23rd of February.
Yeah.
In fact, we were at a conference from the 19th to the 23rd. And
so that was a month ago, just over a month. Yeah.
Exactly a month. Yeah, roughly just over a month. And in a space of a month, Italy has already over 70,000 cases and 8,000 deaths.
Yeah.
In fact, it's 80,000 because it's like roughly 10% their death rate.
That is a massive percentage of deaths for cases. So if you look at the US, it's about 80,000, but 1,000 dead. So you're looking at, whatever percentage that is.
Yeah.
Lower.
Yeah, roughly 1%.
Yeah, roughly 1%. So
compared to Italy.
Yeah, so one of my first questions was, how serious is the virus? I mean, is the lockdown an overreaction? It does seem that it's all about hospital capacity. So if we did have, more hospitals, bigger hospitals with a 10 times capacity, would we still be in the same situation? What do you think about that?
Well, it's not necessarily, you can have the hospitals, but it's also the resources and equipment.
Okay.
So in terms of the equipment, this virus basically attacks your lungs, and a lot of people end up with pneumonia. And when it gets to the stage where you have pneumonia, that's when you end up in a situation where you have difficulty breathing and patients start experiencing fatigue.
Yeah.
And that requires assistance with the breathing, and that leads to people needing to be placed on a respirator and to assist them with the breathing. And the challenge with the respirators is that sometimes a single patient can last up to about 6 to 2 months on a respirator. They cost a lot of money.
Yeah.
And most countries have not, basically in general on a day-to-day life, a country, depending on the size of the population, a country would not need, let's say, more than 1,000.
Yeah.
Some countries have 500. I think we are in Sweden at one stage. Recently, I heard a figure of something like 400.
Only 400 respirators throughout the whole country.
Yes. In terms of ICU, patients have to be placed into ICU, and that's basically for safety of other infections and bacteria. Generally, a lot of these people are placed they go under, so they're unconscious, so they're not awake when they have this apparatus that they're using, this instrument.
Yeah.
And it creates a lot of challenges. So when you say building a lot of hospitals, what China done is when they built 1,000 beds, they basically built 1,000 ICUs.
Okay.
And not that on a normal, when life was normal, society normally has, I know in Sweden they say roughly about maybe 200 people in ICU. That's extreme cases.
Yeah.
But generally it can be down to 80. In the UK, it must be a bit more higher than that, I would assume. So now you're having a virus where you need thousands of people to be on the ventilators. I was listening to the New York mayor speaking about they literally scouring the earth looking to purchase ventilators.
What about the Chinese? So if they don't have as many people in the ICU now, can we not get the Chinese beds or ventilators?
That's basically what has happened. Italy requested assistance from the EU, since they a member, EU state member. That basically fell on deaf ears because a lot of countries within the EU are facing their own challenges. Chinese minister heard this, that's based in the ambassador heard this, so he asked the Chinese government if they could assist Italy. So with that, they asked Chinese government contacted the World Health Organization and asked him if they can go that route.
Yeah.
And they've started to send experts to several countries in the EU to offer assistance, which is needed. As you can see, Spain is fastly
it's pretty bad.
growing and will soon overtake Italy if it continues at this rate.
Jeez, yeah, the rate's pretty hectic. Okay, so we've got a limited time here because we're using Zoom, which I think is getting loaded by so many people now. Right, yeah, so we'll crack on to, I want to talk about creativity, the political side of things, and also the economics. But maybe the economics and the creativity we can bundle in one here. So LifeShot Health and Wellness Podcast is essentially about people's lifestyle, the wellness within ourselves, and actually being creative and being free and also having money helps you to be well, right? I mean, you can't be stressed out. And I think at this time, people are probably quite stressed. I feel the stress myself. You can see that I've got some cold sores on my face, and I've been a little bit under the weather, and my body's, fighting as hard as it can. And this normally is what happens. But I see a lot of creative ways in which people are finding ways to do business, or at least reach out. What have you found? What's your thoughts on this, Wayne?
This platform, for example, Zoom and Skype and WebEx, basically now has been inundated because a lot of people want to communicate. A lot of artists that perform, musical artists, comedians, companies selling their products, conferences, marketing, can only be done through this method and means now, also via social media. So this is being ramped up. So from a technology point of view, you're seeing quite a change. Is a lot of pressure that's being placed on it, both on a good way and a negative way. So guys like you, for example, who wants to use Zoom, you'll start experiencing lags. You'll start experiencing that there's difficulty getting on. So it's basically the time in which you use these tools. So there's a lot of thought into as well after this entire epidemic, pandemic. New methods, new means of going ahead. For example, a lot of companies will think, oh, this is a good tool. And companies will start improving these tools or inventing new tools, virtual reality, to make things much more easier, because now you're looking at the discussion on climate change. Now that the virus has had such an impact, aeroplanes are being grounded.
Yeah, it's going down. Yeah.
Factories are being closed. So I think like 3 weeks ago, you saw the pollution map of China and how that had reduced drastically in the space of like 2 weeks.
Yeah.
And then when it was shown from year on year, you saw the impact of how clean it is. Now that's going to happen in the US as well. It's happening in Europe. It's spreading all over the world. So the Earth's lungs are basically taking a breath of fresh air for a change.
I was listening to, Russell Brand. He's got a podcast, Under the Skin. And he was talking about, from more of a spiritual perspective, what is it that we're being taught in this time? And so I think, we wanted to have Gregory with us, who's a pastor from Durban. I wanted to get his spiritual perspective on this, because I think some people are going down, it's a judgment from God. And then other people are saying, hey, it's a lesson that the earth's trying to teach us, or it's a lesson that the source or the flow or whatever you want to call the greater power is trying to teach us. And I think that is interesting to me, because I think that there's also the people who are saying maybe nature's fighting back. But who knows what it is. But I think what's essential is, like you say, we learn in these times. I was just looking at Carvin H, who did a comedy show on Zoom. And I don't think he would ever have done that, not so soon, if this had not happened.
Exactly.
Yeah.
So, well, from the spiritual side aspect, I often view it this way, that we as humans, we are accountable for our actions.
Mm-hmm.
And the actions that we, so the stuff that we do basically has an impact, a positive impact and a negative impact. And the way this virus came about basically was from somebody that thought they were going to get a positive reaction by eating wild meat based on Chinese customs, practices, and those. And it was a Pangolian.
Pangolo, so what they call those things.
Yeah. That apparently had eaten something from the bat, and that mixture basically resulted in the situation that we in at the moment. So that's basically a negative effect. And this negative effect has had a ripple effect. And the ripple effect is basically the situation that we find ourselves in. From an economics point of view, it's challenging political systems. For example, you have an autocratic system of China, and you have a democratic system. So people are literally discussing and weighing up the two. How effective was the autocratic system when it came down to the lockdown?
Yeah.
How effective is it now in the US when you in a democratic system? And then you're having socialism and capitalism. Americans are implementing socialist systems at the moment where they basically subsidizing. They've just taken out a $2 trillion to assist people in terms of leave, sick leave, unemployment, support or stimulus packages to support companies.
But now, this $2 trillion, are they just printing this money out of thin air? Because they don't have it. Well, it's not like they had $2 trillion sitting in a bank somewhere. Oh, we got the spare reserves of $2 trillion. It almost seems like they're printing money, devaluing the dollar, making money up out of nowhere. And this is just going to cause even further problems for the US.
Well, currently their national debt is at $23 trillion in the US. Yeah. So if you divide that per person, the cost of each person to pay back this debt, they see it as borrowing funds. It's not only the US that's doing this. Sweden is doing it as well. All countries are basically doing it to assist. Yeah. Companies, small to medium-sized companies, need assistance to basically survive. Thousands of people are unemployed now, have lost their jobs in the restaurant, entertainment industry. Yeah. So you're finding there's a lot of challenges that this virus has brought. It's a rude awakening.
So Ed Balls was on the One Show on BBC yesterday. He was saying that he was the Treasury Minister until the year, I don't know when it was early 2000s. Probably getting all the facts wrong here, but he was saying that the debt was paid 60 years after World War II. So the economic impact of the injections from government and whatever may be borrowing from after World War II was only paid 60 years later. So the whole generation was, I wouldn't say the word liable, but we're paying for that, not the bailout, because I don't think bailout's the right word, but the help that they got after World War II. So I think at this point, we're getting all this cash injection and the point aside where the money comes from, because I just think they're printing it out of nowhere, so devaluing the currencies. But nonetheless, getting us out of this is going to take us a long time to pay this back. And it's going to, I don't know if we're going to be better off. It feels like we might be better off now in this new generation with new technologies, with maybe some new creative solutions, that it might take us a little bit less to pay that off. But that's what my hope is.
I think it's gonna bring about a new thoughts in terms of how economics should be seen and dealt with? Because in terms of the value and inflation, the value of currencies, somehow they're going to need to pull back all this money that they're printing. Somehow. Because from an economics point of view, I think you're going to have this impact for roughly, I'd say, 8 to 10 years. America's still they're still seeing the effects of 2008.
That was 9, 10
That's
years
more
ago.
than 10, like 12 years ago.
12 years ago.
Yeah, so the effects of that has taken 12 years. Imagine the effects of this. And this package is the largest stimulus package that they've ever taken. And there might even be a fourth bailout.
The UK is 330 billion, I believe. That was the number I heard initially, but now they're still talking about helping self-employed people. So they might have
they have to consider the full spectrum in this sense. And then the other question was lockdown. Is lockdown really an overreaction? Is it really necessary? In Sweden, we've not gone the lockdown route.
Do you think it will?
On social distancing.
Do you think it will go lockdown?
So, beg your pardon?
Do you think it will go into lockdown or not?
Well, the question is, the way I look at it, it's more from a cultural point of view. So Italians and the south of Europe are more, how can I say it, more like in South Africa, where people are more close, touchy, huggy, outdoors. Yeah, in the Nordic countries, because it's so cold, people are more socially isolated. It's very seldom, unless in the immigrant areas, you'll very seldom find that your grandmother or grandfather is living with you. So in terms of this isolation, they're saying 70 plus needs to isolate themselves because within the country, they know it is possible. But if you were to take it in Spain or Italy, for example, you'll have the son living with their parents and their parents' living in the same house. So you have 3 generations in one house. And then when it comes to the infection, maybe the youngest kid or teenager comes home, he's infected. Yeah. And it just spreads in the home. And then granny and grandpa is struggling. It's the same in Italy. It's a lot of physical touch.
So what's your opinion about the poorer countries? So we came from South Africa originally, and I don't go there very often anymore, not because I don't want to, but because of just getting there, right? It's costly for me and my family. But I'm just thinking about economically. So for me, privileged person in England, working in a job where I can work remotely. Some people are not that privileged. They maybe work for themselves, even in England. So there's some people in England who are unfortunate that they've lost their entire income right now. Fortunately for myself, I haven't. But there's many people in South Africa whose income is just going to take a massive dive, and this is going to cause some major economic problems there. I mean, what is the outlook for the average South African, or even the below average South African? In other words, economically, where they sit on the economic line, what's this going to do to them? I wonder.
Well, if you look at current examples from countries that have been heavily impacted. Yeah. So first and foremost, low income or low skilled or unemployed people are affected the most based on statistics and studies in China. Italy is showing the same thing. So in general, people that are not financially stable and cannot sustain their health needs, for example, eating healthy, living a healthy lifestyle, working a reasonable, normal hours, less stressful, having regular checkups, exercising, all of those things cost. Eating a good diet, that all costs. So they're showing that the studies are showing that in China, that people that cannot afford to live their lifestyle have been impacted the most from the virus from that point of view, and also from a financial point of view.
Yeah.
Italy, if you look at the age groups, it's a lot of men that have either smoked a lot, have underlying illnesses, and that has taken a toll on that group of people. And that's from research that's been done to date. So taking that information and looking at countries like South Africa, some other countries in Africa and around the world, I think you'll generally see the same effect. I know here in Sweden, most of the deaths are contributed to, the contributing factors have been people with underlying illnesses. And then also there's a high number of people that come from the immigrant population. So, and Sweden's a social system, so you have a good healthcare system, but then at the same time, you also have cultural dynamics, how people eat. Do you eat a lot of junk food? How does that impact you? Do you have high cholesterol? Do you have high blood pressure, low blood pressure? Do you have diabetes, cancer? And a lot of people that have these ailments generally are
not do well. So my concern is this: in South Africa, especially, and a lot of African countries, I'm not going to say it's a conspiracy or anything, but the meal industry with the corn meal, so that would be maize, for example. Maize in itself is actually a very high glycemic, it's a very high GI food. So it actually spikes your blood sugars up a lot, right? And so it's a food that is very common in South Africa, and actually if you think about the diet that many low-income South Africans are eating, it's very carbohydrate based. It'll spike their blood sugars very much. They eat a lot of sugar. So you've got a bad combination of it's basically a bad diet. and these companies do that because they know they inject that maize meal with a bit of vitamins just to prop it up a little bit, but that's not really helping. So my thing is this. I think that if anything can be learned from this, and I wish we could just wave a magic wand and say, for these people in these low income areas, because I've been to like the Valley of 1,000 Hills, and I've been into those areas, those rural areas, and I've seen how people live there. And actually, in a way, it's quite peaceful there. But at the same time, they're quite close together, but they do have land around. And I'm thinking, is there a way in which they could better their situation, even not just for a pandemic, not just for a virus outbreak like this, but also better their health and their ways of living by having maybe a co-op type allotments there, so they're growing food and they're feeding themselves off the ground, off the earth basically, and not relying on what's fed to them by big companies like maize meal and all that stuff. I mean, to me, it just sounds like a better way to live. I'm just not sure how reasonable or realistic that is, but it does seem to me that it's something that they should strive for, or should try and help. We should try and help with.
That's in the perfect world, Clint, because at the moment you see in South Africa the main topic is land. Yeah, and then also with globalization and freedom of movement and freedom of speech and people wanting to move to the cities, the talk of employment and earning money. So that's why you've had a huge influx of people to cities. And this is all over the world because, and despite the competition and the difficulty of finding jobs, people still believe that they will find jobs in these places. Then the other topic is climate change. You have low rainfall in many parts of Africa and South Africa. We've had places of recently, Cape Town, the Free State, KZN as well, where those people, if they had to plant, where would they get water to
irrigate?
Irrigate. It requires a lot of water. It requires quite a lot of resources that we generally take for granted and think that it's easy to come by.
It's
water
true,
is quite difficult to come by. And I was in Botswana. And Botswana relies a lot on South Africa for food. resources like crops, like maize and stuff like that, but they have huge amounts of land. But Botswana is changing that around and changing that around very quickly. But also the problem is water resources. Where do they find water? I know there was a young lady that came to me and said to me, if you could just help us with digging boreholes or finding equipment in Europe to help us dig boreholes. And something as simple as that, you know, if they could do that, they could turn their lives around if they find water. It makes a big difference. And then coming back to the impact. So this 21-day lockdown, South Africa's economy is made up of the informal sector and the formal sector. The informal sector is basically the people that are selling on the sides of the streets, the taxis that are running. So for 21 days, when all of these, when it's pure lockdown, and if they have proper lockdown, you're going to find that the lady that sells on the sides of the street, they're not going to be able to get resources, and they're not going to be able to sell. So they're not going to be able to feed. If they're not planned ahead, which in most cases people would not have, because the government had said, I think it was like 3 days ago, that there's going to be a lockdown in 3 days' time. So where do you get the funds if you don't have funds? A lot of people live on credit. A lot of people have family members that send money to them. And then there's another situation where you have grandparents that take care of their grandkids. Some parents have died of HIV/AIDS. So there's a lot of factors that one needs to look at. And I think the reason why the government has gone down the lockdown route is they're taking into consideration all those factors. If those grandparents were to be wiped out from this virus, because it's impacting a lot of the older people, imagine you'll have a lot of orphans. That's not been discussed. And then there's also companies that don't survive. People will be out of jobs, and South Africa already has, I think it's 28% unemployment rate.
It's very high.
So the impact, Carvin pointed out something that was very interesting, the migration. And this I personally experienced when I was in Italy, when we were leaving Italy, the fear of coming into contact with somebody at the airport, just the thoughts, the taxi driver, the bus driver that was driving us to the airport, the stress around that, him telling us, you guys need to get out of here just before they lock down streets. It took us, I remember the trip, it took us 3 hours to get to, when we left Milan, to get to Bormio. On our way back, it took us 2 hours. So this guy was really traveling really fast. And the fact that he was stressed also made us more stressed. Does he know more that we don't know? And then we realized that also that they were testing when we arrived in Italy. So it's obviously they knew more than that was actually being let out, information-wise. So we didn't know if we had picked up the virus, if we were contagious or infected. So there's a lot of things that go through your mind. Even when we had the masks on, we were thinking about touching the mask to readjust it, reset it.
It's hard not to touch your face.
Exactly, things like that. So there's a lot of aspects to it.
So I think we're gonna end off, Wayne. It's been great talking to you. Now, I was just thinking about when this first all started. Going on in my head was a lot of things like, we can't do lockdowns. What's it going to mean to the economy? And then I'm thinking, well, we've got to save lives. And then I was talking in the chat about, well, it's very noble that we want to save lives right now, but when it actually impacts us in a very negative way, like we've got no food on the table, we're really going to question ourselves as humans. And I think that I don't know if the tests are going to come like that. I don't know if we are all going to be tested in ways that really reveal to us what we're really capable of. I hope not, because each one of us is capable of really good things, and each one of us is capable of really bad things. And I think that it's really good at the moment that people are pulling together. We're all in this together. There's a lot of videos about that. We're in this together. And I say, long may they live. You know, I really want us to work together as an entire global population to try and get rid of this. And I hope that things don't turn really bad. But time will tell. And I am worried about, you know, people even in the less developed countries, that this is going to be a major blow. But at the same time, we struggle within ourselves, don't we, to kind of like lean on one side, or at least be positive in these times. I don't know how you feel about it, but it is hard for me to not be skeptical sometimes. Not about what it is and what it's doing, but when it first started, I was thinking like, why is this happening? Is this been a ploy by some government organization or some person or whatever? But you know, the more you get into it, you think, well, it's just happened. You know, shit happens, and you got to get on with it. And no one's planned this. But in a way, it almost feels like, you know, who was it that planned this? You want to blame someone, right?
That's what we always want to do as humans. Look for somebody to blame.
Yeah.
Well, in one essence, it's been quite interesting because in the US, people are going out buying weapons and ammunition.
Yeah.
Whereas in certain parts of the world, people are going out to buy toilet paper.
Mm-hmm. Mm-hmm.
So that kind of tells you the trust of society.
Mm.
So the thing is, it comes down to cultural discipline and trust, and the social structures within a society. So if you look at Asia, how they've managed to handle and deal with this outbreak in China, Japan, Taiwan, Hong Kong, if you see the numbers, they are quite low, and they've managed to contain it. South Korea, it takes a lot of discipline from the societies to work together.
Mm.
And you think about the next person. So my colleague two of my colleagues who are Asian, they tell me that they wear the mask not for themselves, but for others.
Yeah.
To protect others. So that mentality generally comes from Buddhism. And in the West, you generally have Christianity, or the social contract that we believe in, that we believe in the law and the system that to protect us, and the government and society to stand together. So we trust and believe that in a situation where we require assistance, that we will get it from each other, and that society will work together. And at the moment, here in Sweden, Sweden, out of all the countries in Europe, have not closed their borders. So we're trusting in the ability to isolate ourselves and to respect the next person by keeping our distance.
Mm-hmm.
And if you have a cold or a basic flu, you think you have the flu, just stay at home and isolate yourself for 2 weeks.
Mm-hmm.
So the government has not gone out and said we're doing a lockdown. We want industry to continue.
Yeah.
They're saying support your local hotel so that they don't go under. Support your local guided takeaway. Buy pizzas, buy food, if it's twice a week or once a week, so that they can at least sustain to have their running costs.
Yeah.
So that's basically the message that society needs to work on. And I think government needs to plays an important role, media as well, in encouraging each other and basically protecting one another. And in countries that are underdeveloped, you're going to find the social structures are not genuinely in place, in the sense that you have, where there's corruption, it becomes more difficult.
Yeah.
So in South Africa, we talk about Ubuntu.
Yeah.
That's going to be tested now.
For sure. Yeah. I think so. It's definitely going to test a lot of that, of what goes on there. And I hope that Africa comes out stronger. And I think it will. I think it will come out stronger from this. there'll be a lot of learning lessons, and it's about learning from those lessons that we need to implement, right?
Yeah. My hope was that, like Corvin had shared this morning, and one of the doctors here in Sweden who said that with HIV and Ebola and tuberculosis, you generally find that countries in Africa have good methods and structures and experience when it comes to outbreaks and epidemic situations like that.
Yeah.
So Asia's shown they've had experience. They have experience from SARS and swine flu and all of these other past outbreaks. Let's hope that South Africa's learned a lot. We didn't learn from Italy's mistakes, where when they went down on lockdown, that people still left the epicenter. That's something we should have learned, and that we have not learned. And I think it's the same for many other countries. So
good thing to mention, so that hopefully people will learn from that. Or that might be too late now.
Might be.
Yeah. Wow, Wayne, it's been great talking to you, and thanks for being on the show today. Wayne Dilles from Sweden, the man who's all into political science and economics. So Wayne, it'd be good to have you on the show. I see that Carvin has actually just pinged me. Perhaps we could do episode number 2.
Sure thing. Thanks, Clint.
All right, cool, man.
Keep well.